Now students, in today's lecture, we will study that what is plasma half-life. Now, what is plasma half-life? Plasma half-life is actually referring to a particular time. This is the time that is required for the concentration of the drug in the plasma to decrease to 1/2 of its initial value. So whenever you define plasma half-life, it means you are talking about the time, and this is the time which is required for the drug concentration in the plasma to reduce to the half, to reduce to the 50% of the initial value. This plasma half-life is designated or abbreviated as T-half as represented in this slide. Now, what is the formula for the plasma half-life, or how you can calculate plasma half-life of a drug? It can be calculated from the formula, that is T half is equal to 0.7 into volume of distribution divided by CL, that is clearance. VD is the volume of distribution and CL is the drug clearance. So, how you can understand the concept of plasma half-life? Let's consider that we have a drug that is of 100%. So what will be its first plasma half-life? First plasma half-life, that is after first plasma half-life, it will remain or it will be reduced to 50%. After second half-life, it will be reduced to 25%, which is the half of 50. After third half-life, it will be reduced to the 12.5%, that is half of 25%. After fourth half-life, it will be reduced to 6.25, that is half of 12.5. Then after fifth half-life, it will be reduced to 3.125, which is half of 6.25%. So similarly, you can understand it by using the fractions, like you have drug of 100 milligram. So at time 0, the amount of drug in the plasma was 100 milligram. Now, after first half-life, the drug is reduced to 50 milligram. After second half-life, it has been reduced to 25 milligrams. After third half-life, it has been reduced to 12.5 milligram. After fourth half-life, it has been reduced to 6.25 milligram. After fifth half-life, it has been reduced to 3.125 milligram. Similarly, as in the previous slides. So, in each step, you are getting 50% of the drug which is to be metabolized. Now, what are the factors that may affect plasma half-life of a drug? There are certain factors like volume of distribution, plasma protein binding, drug clearance, kinetic parameters, presence of second drug, disease conditions, active metabolites, enterohepatic circulation, and hepatic blood flow. Now, firstly, moving towards the volume of distribution. Now, when we talk about the volume of distribution, it means we are talking about the distribution of drug into the tissues. So, it means the drug is leaving the plasma compartment and it is entering into the tissues. If we have larger volume of distribution of a particular drug, it means most of that drug is in the tissue and later is in the plasma. So, longer volume of distribution will basically represents the longer half-life of the drug, because the drug is present in the tissue. Most of the drug is present in the tissue. If there is larger volume of distribution, it means there is larger amount of the drug is in the tissue. There is possibility of greater half-life or the longer half-life of the drug, because there is a possibility if your drug is in the tissue, possibly it is bound with the tissue proteins, right? So most cases or generally volume of distribution, large volume of distribution means longer half-life of the drug. Now coming towards the plasma protein bonding, that is the second factor. Now, if your drug is bound to protein, it means your drug is in bounded state. It is not in the free state. It is not unable to exert its therapeutic action. It is not undergoing the process of metabolism. But whenever you have unbound fraction of drug, whenever you have free drug, it means your drug is available for the therapeutic action. Your drug is available to get metabolized. Your drug has the chances of being cleared from the particular compartment from the body. So whenever there is plasma protein binding of the drug, it means there is longer half-life of the drug because your drug is not undergoing the process of metabolism. Most of the acidic drugs bind to albumin, while basic drugs bind to the globulin. We have an example of warfarin, which is an anticoagulant. Warfarin is an acidic drug because it binds extensively to protein, that is the albumin, and warfarin has longer half-life. So bound in drug means drug is not distributed to the tissue, it is not metabolized. So it means if it is not metabolizing, the drug has longer half-life. So this slide is summarizing that high plasma protein bound drugs have increased half-life. Now coming towards the clearance. What is clearance? Drug clearance is defined as volume of plasma cleared of drug over a specified time. So increased clearance actually represents decreased plasma half-life of a drug. Now coming towards the main factor, that is pharmacokinetic pattern. There we have discussed first order kinetics and zero order kinetics. We have already discussed these orders of kinetics in our video lecture of drug clearance and excretion. Now again repeating these, your first order kinetics is basically concentration dependent process. Whenever there is higher concentration of the drug, there is faster clearance of the drug, because in this system we have excessive amount of the free enzymes available. We have excessive amount of enzymes are available which never get saturated and are able to metabolize the drug. So in this case, however, there is fixed fraction of a drug which is get cleared, which is get metabolized. For example, if you have 100 milligram of a drug, so what will be the fixed fraction for that? Only 10% of the drug is getting metabolized. So then after time, you will be having 10% of the drug metabolized. So after another time, after the second hour, again 10% of the drug will get metabolized. So what will happen in this case? That a fixed fraction of drug is getting metabolized. So as there is a fixed fraction of drug that is getting metabolized, it means this half-life of a drug is independent of the drug concentration. So in that case, your half-life will remain to be constant. Now coming towards the zero order kinetics, that is saturation kinetics or non-linear kinetics. This is concentration independent process. That is there is a constant amount of drug, for example grams or milligrams, that is eliminated per unit of the time from the body. So there is a fixed amount of the drug that is getting metabolized. For example, if you have 100 milligram of a drug, and for example for that the fixed amount to be metabolized is 10 milligrams. So after first hour, 10 milligram will get eliminated. Then after second hour, 10 milligram will get eliminated. So in that case, what is happening? We also have an enzyme system. But this enzyme system has a limit. We have limited amount of enzyme in this case. We have limited amount of enzymes which are available to metabolize the drug. When that limit is reached, metabolism occur at a constant rate. Thus, enzymes become saturated. So we can say that if at this stage enzyme have become saturated, in this case, if you are further increasing the amount of drug, then it means increasing dose will result in increase in the half-life of the drug. So in case you have a second drug and this drug is acting as an enzyme inducer, that is increasing the metabolism of the first drug. It means it is decreasing the half-life of that first drug. Secondly, if you have a second drug that is acting as an enzyme inhibitor, that it is inhibiting the metabolism or decreasing the metabolism of your first drug, it means your second drug is actually increasing the half-life of the first drug. Now, if your patient is suffering from any kidney disease, that is your kidney is unable to excrete the drug, it means it is increasing the half-life of the drug. If patient is suffering from hepatic diseases, that his liver is unable to metabolize the drug, it means in that case that particular disease is actually increasing the half-life of the drug. Now, active metabolites. We have already discussed in the topic of metabolism that whenever we have drugs, probably it may be in the active state and exerting its action, and then after metabolism will be excreted out of the body. Now, in other cases, we have drugs which act as a prodrug And after metabolism, it is get activated, and in that case, sometimes its half-life increases. For example, we have aspirin, whose half-life is 15 minutes, but its salicylic acid has half-life of 2 hours. So we have 3 states of drugs. Firstly, you have taken drug which is already in the active state. Secondly, you have taken drug which was in the inactive state, and after metabolism, it has been converted into an active state. So from the pro state, it has been converted into an active state. Thirdly, probably you have the drug that was active but not as much active. But after metabolism, it is getting more activated. So this is possibility that after metabolism, sometimes we have metabolites which have longer half-life as compared to the parent drug. Now coming towards the enterocytic circulation, what happens in enterocytic circulation? That drugs is excreted in the bile and is reabsorbed from the intestine, and then which will result in increase in half-life of the drug. What happens that most of the drugs are metabolized in the liver. That is, they may undergo conjugation process, after which they are excreted in the bile, and in the intestine, what happens? These conjugates are again broken down by the bacteria and the enzymes. And what these bacteria and enzymes do, they will activate the drug again. So they will produce active metabolites. Now, what these active metabolites will do, they will again enter into the plasma. It means we are increasing the half-life of the drug. So what happens in enterohepatic circulation? There is in enterohepatic circulation, the drug's half-life get increased until and unless it is fully metabolized into an inactive metabolite and excreted from your body. Now, hepatic blood flow. If you have decreased hepatic blood flow, for example, it happens in certain disease conditions like cardiogenic shock, cardiac failure, and hemorrhage. In case of decreased hepatic blood flow, it means your less amount of drug is flowing towards the liver. It means your less amount of drug is getting metabolized. It means decreased hepatic blood flow is actually prolonging the half-life of your drug. Now, what is the clinical significance of half-life of the drug? From the half-life, you can get estimate of the rate of elimination of the drug. You can get estimate of duration of action of the drug. You can get estimate of the dosing interval. You can get idea of designing a dosing regimen. Now, firstly, moving towards the rate of elimination. So, if your drug have increased half-life, it means its elimination is slow. If your drug has decreased half-life, it means its elimination is fast. So, from half-life, we are getting idea about the elimination of the drug. Now, your half-life also indicates us about the duration of action of the drug. If your drug has longer half-life, it means it has longer duration of action. If your drug has shorter half-life, it means it has shorter duration of action. Again, your half-life can indicate us about the dosing interval. If your drug has longer half-life, it means it will remain in your body for a longer period of time. It means in that case, it will require the long dose interval, long time between the doses. If your drug has shorter half-life, that is, it means your drug will remain in your body for a shorter period of time. It means short dose interval is required. As you know, your drug is remaining or retaining in your body for a shorter time. So again, you have to repeat the drug, but after a shorter interval. Now, your plasma half-life is also important in designing the dosage regimen. What is the dosage regimen? It is the plan or the manner in which the drug is taken. It specifies the way a therapeutic drug is to be taken. It indicates us about the formulation of the drug, route of administration of the drug. It tells us about the dose, dosing interval, and the treatment duration. Now, if your drug is with the shorter half-life, it means it requires more frequent dosing. If your drug is with longer half-life, it means it requires less frequent dosing. Now, plasma half-life of some drugs, we are discussing some examples. This table is representing us 4 different drugs. These drugs are actually the macrolide antibiotics. So route of oral absorption of these drugs representing the oral absorption. All of these 4 drugs are getting absorbed by the oral route. They are converted to erythromycin is not converted to inactive metabolites after metabolism, while rest of the drugs are converted into active metabolites. So this last row is actually representing how much percentage of the metabolite or the drug is excreted in the urine. Now, our main concern is about the half-life of the drug. Here, these metabolite antibiotics include erythromycin, clarithromycin, azithromycin, and telithromycin. Here, half-life of erythromycin is 2 hours, half-life of clarithromycin is 3.5 hours, half-life of azithromycin is more than 40 hours, and half-life of telithromycin is 10 hours. So this was all about the plasma half-life, factors affecting the plasma half-life, and the clinical significance of the half-life.